Hey guys, so when I was talking about in a previous video, talking about that I had to report the provider that actually saw me when I went to the emergency room when I passed out at work, I kind of wanted to discuss that a little bit in today's video. I felt like I was ready to talk about it. I just want to preface this by saying that um, I hate the fact that I had to report someone that I work with. Um, I shouldn't have to have been treated the way that I was. I should have been listened to. And I just want you to know that if you are going to seek healthcare and someone is not listening to your concerns or even taking the time to hear what you have to say, and you know that something is wrong, definitely speak up for yourself. You deserve so much better. You deserve to have your concerns listened to, be able to voice your opinion and your thoughts, and have them taken seriously because it's dangerous. So I've already kind of talked to you in a previous video about what happened at work. Long story short, I had a normal day up until all of this happened. I went to the bathroom, was washing my hands, started feeling nauseous, woke up on the floor, not sure how long I was on the floor, crawled back to my desk, was able to call the ER because I work in a hospital, and told the nurse that answered that I needed help, and they ended up calling a rapid response up to the sleep center for me. From that rapid response, I was brought down to the emergency room, and that's when kind of all of this craziness started. So they did a whole bunch of blood work. They did one EKG the first time I went, and then I went back later that night because I was still in excruciating pain, and they did two more, and it was a shit show, I will tell you that. So first of all, that provider had told me that my labs were normal, everything looked fine. Upon reviewing my MyChart test results, though, none of my stuff was really completely normal. I mean, there were tests that were within normal ranges, but my liver enzymes were severely elevated at that point. I had some things that were way off from what they should have been. Like, I had liver enzymes that were in the 900s, close to 1,000, and he did not take my concerns seriously. When I went in, I was having pain like in this area from the middle all the way to the side and going around to my back, and he never really listened to me. He ended up telling me that it was anxiety because the previous provider that I had seen had given me Ativan to use like when I was traveling, because I had mentioned to him that I was traveling to Memphis and I was a little nervous about the flights and traveling by myself. So he had given me Ativan just as something to use if I felt like I was getting too anxious or too nervous about something, to just kind of calm me down. So because I had that on my record, in my chart, I should say, as a medication, he basically told me that all of my chest pain and my concerns were because of anxiety, and that I needed to go home and take my anxiety medication and that I would be just fine. Now, I do not dispute the fact that I have anxiety, but my anxiety does not cause my liver enzymes to be almost 1,000. My anxiety does not cause 3 EKGs to be abnormal, where they said they cannot rule out anterior infarct, which is like muscle death, if I'm thinking of that correctly. I don't work in cardiology, never have. I have seen a cardiologist previously for palpitations, and I do have a strong family history of heart problems. So I am concerned anytime that things are abnormal in that aspect. I did not feel listened to at all. And just the fact that he told me to go home and take an anxiety medication and that everything was going to be fine really just pisses me off, because if I would have done that, I could have died. If I would not have gone to seek medical care at a different facility where I subsequently got admitted the day after he told me to just take an anxiety medication, even though that particular facility didn't find out what was wrong, um, they told me it was a virus. And when I was transferred to Petoskey, Michigan, to the hospital there, McLaren Northern Michigan Hospital in Petoskey, when I was transferred there, they did all these tests for different viruses and things like that, and all of them came back negative. So this other hospital didn't find out what exactly was wrong, but they at least tried. They made a huge effort to try to figure out what was going on with me. And, even to this date, I don't know what caused this. Because, like, I had a liver biopsy. I am having testing done next week in Grand Rapids, Michigan. It's a lot. And this story is not done writing itself because, like I said, I have no idea why this happened. And so now I'm on a search for a reason behind all of this, because it's very stressful to even think about the fact that I don't know what caused this and I don't know how to prevent it from happening in the future. So basically, I ended up reporting him to one of our social workers at the hospital, who kind of handles all of the patient issues and complaints. I told her, I don't want to get anybody in trouble, but I feel like our community deserves better. Like, just the fact that, like, when I was voicing my concerns and telling him that I did not feel like it was anxiety, he was just kind of standing there like this, like he was in the corner of my room, just standing here with his arms folded, as if to say, like, what I have to say is what the truth is, and I don't care what you say because you're wrong. Like, yes, I understand. I have anxiety. I've had anxiety for years, but I am telling you, I know what my anxiety feels like, and this is not that. And I just hate that it had to come to that point because, like I said, I don't want to get anybody in trouble, but I feel like our community deserves better. We already have limited healthcare resources where I live because I live in a rural area. We are a critical access hospital in the Upper Peninsula of Michigan, and like the closest hospital from my hospital that I work at is 45 minutes to an hour away in either direction. There are 3 other hospitals, but the closest one is like 45 minutes away. So just to give you an idea of how kind of spread out we are. So yeah, it just really frustrated me. So if you ever find yourself in this situation, find an advocate or a social worker at the hospital, make a complaint, stick up for yourself, voice your opinions and voice your thoughts and concerns. And if you have any suggestions to offer to whoever you choose to make your complaint to, definitely offer suggestions for, like, if you can think of any ways that they could have improved or done things better in your situation. Definitely offer your thoughts and concerns and suggestions and opinions, because, like I said, people don't deserve to be treated that way when you're literally, like, you are in pain or you are ill and you're not feeling well. Obviously, it takes a lot sometimes for people to even come in and seek care in the first place. And, I didn't want to be there, but I passed out at work and I didn't know why. So it just irritates me that he told me that all my stuff was normal and that it was anxiety and I just needed to go home. Anyways, let me know if this has happened to you. If it did happen to you, did you report it? Did you, make sure that you stuck up for yourself? How did you handle it? And anyways, that's it for today. If you guys have any questions or topics you'd like me to discuss, please be sure to let me know, and I will talk to you guys again soon.